So, Amie, as you look around, what are some of the challenges people are experiencing when they put together a clinical evaluation for review by notified bodies?
I think the biggest challenge is just not knowing what the expectations are.
Hmm.
And it's an unfortunate consequence of the way the system is set up because notified bodies are effectively subcontractors. That's not quite the right term for them, but they're doing work on behalf of the regulators, but
Hmm.
they're commercial organizations. And because of that, there's a lot of restrictions on what could be perceived as consulting. So notified bodies
Hmm.
cannot do anything remotely resembling consulting. All they can tell you is what the regulations say. Now, this is kind of frustrating for manufacturers because they can go to the FDA with their clinical plan and say, this is the kind of study we're planning to do. This is what we think the right endpoints are. What do you think? And the FDA will
Hmm.
come back and say, no, we don't think that's good enough. Oh, that's great. But if you go to a notified body, they will just tell you whether it does or doesn't meet the regulation. And that's quite frustrating for manufacturers because they don't know if they convince their finance department to invest millions in whatever study, and then 2 years
Yeah.
later, is the notified body going to accept it? Or are they going to chop off their indication? So I think that's a big issue. This is the way the framework is. It's not anything notified bodies can do anything about. But we're hearing about these structured dialogues, and it may be that these will develop in such a way that they can be a bit more forthcoming
Hmm.
about what the requirements